Hello and welcome back to Take 5, an inventory series where we take 5 minutes to discuss the healthcare supply chain issues of the day. I'm Alex Diamond, and I asked Carl Nattenstead, a healthcare supply chain pro for the last 20 years, what he thought about an article in Supply Chain Dive claiming that we can blame the COVID-19 supply shortages on just-in-time inventory practices.
In the healthcare industry and specifically in the hospital industry, just in time is driven by a number of factors. First and foremost, obviously, is capital management. So, trying to use the right amount of invested capital or dollars to have the right amount of inventory on hand. And the less just in time you are, or the more overstocked you are, the more capital you have deployed, it's more costly. So, that's one factor. The second factor, which can't be ignored in the healthcare supply chain, is space and space restrictions. Most healthcare institutions, certainly at the local hospital level, are very restricted on space, and space is at a premium. And even in some of our larger health system clients, space is even at a premium in their local distribution center or their central supply warehouses. So, all of those things are driving the industry adoption of just in time. The second part of the problem and therefore solution is that most healthcare systems were dependent on one supplier for almost all of their PPE. And generally, that's your distributor. The normal supply chain through their normal distribution partner is so reliable that they can almost always guarantee that they can get any PPE they need within days, if not a week. So most hospitals and healthcare systems are ordering all their PPE product, masks, gowns, face shields, gloves, through their distributor, and 100% of their volume is going through that distributor. Now, when you multiply that by hundreds of hospitals going through that same distributor, what you have is a choke point. And so what I'm thinking most health systems need to be considering in the future in their pandemic supply plan is that take some of that volume and pull it out of distribution and have it come through a secondary channel, one that might be a little bit more responsive to blips in the supply chain needs. So perhaps it's one through direct sourcing and maybe directly with manufacturers. So not unlike what they're doing today in response to the pandemic, but do it on a normal day-to-day basis where some percentage of their supply, perhaps maybe as much as half of their supply volume, is coming through this secondary supply chain that is more direct to supplier and that could be more responsive to a spike in need. If they want to have this secondary supply channel, they either need to loop it in under their GPO commitment, in other words, convince the GPO or partner with the GPO to bring those new suppliers also under the agreement, or they need to go back to their GPO and negotiate that a percentage of their supply purchase is going to happen outside of the normal distribution supply channel and is going to be done directly with manufacturers, potentially offshore or onshore, that they can then use to handle spikes. And I think now's the time to go make those negotiations and changes because everybody is aware of the driving need. And so there's been an event. And not to steal a phrase from Congress, but don't let a good crisis go waste. So use this crisis as a reason to drive your leverage point in your negotiations with your existing suppliers to take some part of your supply, normal supply purchase, and move it into new channels. And that way, if and when another crisis hits, and you try to accelerate that channel, you're not working with brand new suppliers like our previous episode of the Take 5, where you have to negotiate new agreements and vet new suppliers. You're simply going to your direct channel and trying to turn the volume up on that one a little bit and hope that offsets some of the disruption in your other channel. So I think my advice would be twofold. So one is I would say you should have a pandemic plan that's ready to kick into action. People, responsibilities, secondary suppliers, pre-vetted, all of those types of things should be in your plan. And then secondly, I think you should have a post-pandemic plan that's ready to kick into action.
We'll follow up on that in our next episode dealing with excess inventory after a pandemic subsides. Take 5 is a production of Z5 Inventory. To see all of the sources and resources for this episode and more, visit z5inventory.com. That's the letter Z, the number 5, and the word inventory.com.